Well, good afternoon and welcome to today's webinar, which is Zero Heat Cases, the prevention secrets that top employers are using. My name is Holly Foxworth. I'm a registered nurse and I'm the Vice President of Marketing and Communications here at Axiom. I'll be your host today. In terms of our discussion topic, we're actually going to be talking about why it is that heat risk is not always as obvious as what we think. Many times you'll see organizations and they feel like that just because they look at their safety log or they look at their incident data and don't see a long list of heat cases that are on there, they feel like that they have a heat program or their heat situation under control. But here's the problem is that heat doesn't always record as heat per se. Many times that'll show up as a fall. Many times it'll show up as someone being struck by an object. Maybe it's somebody's attention span. They're unaware of what's going on, they have a lapse in judgment, whatever that may be. But many times that's connected to heat, but we're not making that association. So that's what we're unpacking today. We're going to go through all the ways that heat impacts the body. We're going to be going through the brain, the body, safety outcomes, and also your ability to prove that you have the right prevention steps that are in place so that you're ready to go. So by the end of this hour, our goal is that you not only look at heat risk a little bit differently, but that you also look at your own data with a little bit sharper eye to determine whether you're missing an opportunity there to identify what could be going on, what can be the underlying issue that may be occurring with your employees that starts with heat. So we have a fantastic panel that is joining us today. We have Dr. Scott Cherry. We also have Dara Wheeler. And we have a special guest with us that's joining, Matt Maripode. And so he is from Epicore Biosystems. So he'll be actually talking us through some of the things that employers now have the ability to see that perhaps that they didn't maybe 5 years ago. So a lot of things are changing, a lot of things are in flight. So you definitely have more tools than what you previously did. And we want to go through what some of those are. Before we get started, I would just kind of bring your attention to there on the right-hand side of your screen at the top. That is where you get signed up for our next event. That's going to be next month. It's called Stuck on Leave. So if you have any employees that you're wishing that they were getting back to work a little bit faster, or that you feel like that they're running into roadblocks there in terms of what it takes to get them safely back to work, this is definitely the webinar that you want to attend, and bring your risk people with you as well. We have Sarah Hathaway that's going to be joining us for that. She's going to be actually going through the psychological pieces that are associated with leave and how that impacts the way that an employee feels mentally and how that has an impact on their ability to return to work. So she's definitely going to be putting together all of the pieces to that puzzle and going through it. So if you'll just click that button that says register now, it'll get you registered. You don't have to enter any additional information, and it'll send you that calendar invite. In terms of today, we always love to hear from you guys. So whether it's you're sharing your own stories, whether you're telling us about a challenge that you're facing, whatever it may be, whether you just have a hot tip that you want to include in this chat, all of those are definitely welcome and much appreciated, and they're also recognized. I like to go through this list at the end of these events and look at really who's engaged the most, who has some really thoughtful questions that's driven the conversation. And I definitely like to send some gifts after these events. So make for sure that you're paying attention, that you're in there, you're answering the questions. We'll have some surveys, things like that. So if you're interested in gifts, that's exactly how you want to get them. Additionally, I was going to mention that we will be at ASSP this next month. So that's going to be in Anaheim, California. So if you do not already have passes and you would like to attend that, definitely drop your name in the chat, and we will make for sure that you not only get a pass to the ASSP, but also we're hosting an after hours event. So that would be outside of what the normal trade show would be. We will be at a local brewery that's there. You'll have an opportunity to network, get to meet some of the people that you'll be seeing here today as well, and talk with the Epicore team. They're going to partner with us on that one. So we definitely would love to have you. So if you don't have that already, drop your name and we'll make for sure that you have that there. And then finally, today does qualify for SHRM continuing education credits. to make for sure that you're able to get those. What you would need to do is just make for sure that you continue through the remainder of the hour and then answer a brief survey at the end. And then you should be able to print out your certificates at that point. So there's lots of resources that are located below. We have the engagement hub. We have all of the slide decks. We send out a recording of this 24 hours after. So there's definitely lots of things that you can look at and reference there at the bottom of your screen. So at this point, I'm going to go ahead and bring in our panel and let them introduce themselves. Dr. Cherry, let's start with you.
Thank you, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting worker populations for the past 15 years.
Fantastic. And Dara?
Hi, everybody. Great to see you here. My name is Dara Wheeler. I'm Axiom's Chief Marketing Officer. I've been supporting our clients and their employees for about 20 years here at Axiom. So I'm really excited to speak with all of you today.
Thank you. And the star of the show, Matt.
Hi, everyone. My name is Matt Maripode. I'm the Chief Strategy Officer with Epicore Biosystems. My background is in biomedical and mechanical engineering. Started my career in spinal implants and devices, and now work with Epicore on bringing to market innovative wearable solutions for industrial settings. So looking forward to the conversation today.
Fantastic. Well, thank all three of you for joining us today. I think this is going to be a great conversation. I already see questions that are rolling in, so it looks like we'll have much to discuss. But what I'd like to do before we get into the specific content is just kind of level set. Let's see where we're at. And I'm interested personally in what's going on within your work environment there. So the question then becomes, what does your organization monitor, how it is that they monitor heat today? So are you looking at environmental only? You know, are you looking at heat indexes? Are you seeing what is occurring with the weather patterns, things like that? Are you relying maybe just on supervisor observation, that the supervisors are watching your employees and you're expecting that they would be able to pick up on a heat-related type of concern? The other would be, do you have a formal program that you're currently using? And if so, what is it? I'm sure there's lots of people in the chat that would love to hear what you're doing as well. And the last one being the physiological monitoring. Are you using any type of device, such as a wearable or anything that would support you in that heat prevention strategy that perhaps you didn't use years prior? So I'd love to see what you guys are coming up with. Let's see. Okay, Haley, I'm seeing that you're saying that the NIOSH heat index app, absolutely. Awesome. Dr. Cherry, what are you most familiar with? What do you see the most in the field there?
You know, I think it's a mix of just based on, you know, where the companies are coming from and, you know, maybe even personality driven. But, you know, my experience that I saw in the Army is there are formal programs that include, you know, wet bulb globe temperature, work rest cycles based on, you know, those settings. And then there are like just anecdotal kind of approaches where you do have hydration requirements every 2 to 4 hours.
Okay. Well, it looks like that the majority are saying that they're definitely using those heat indexes. Several are mentioning apps. Yep, there's another one that said they're monitoring indoor as well as outdoor. That's a really good point. That's not something that you normally always think of in terms of where that heat exposure risk lies, especially on the inside of a facility. So excellent point there. Matt, I'm going to come to you first. And one thing that kind of jumped out to me was this number that's sitting here, this 28,000 entries a year that come across as being coded as a heat type that are other than heat. So maybe it's a fall, maybe it's a sprain strain. Why is this occurring where we have a misclassification of what is actually going on with employees?
Yeah, maybe I'll even bring it back to the earlier point. You know, we just completed surveys of looking at a few hundred companies out in the sector, primarily within oil and gas, but also electric utilities and other sectors. on the kinds of tools that they use. And, most everyone says that they use some kind of heat index monitoring and scheduled water breaks. A lot of people rely on, as they should, face-to-face with the workforce and looking for things like behavioral changes and symptom tracking and a buddy policy. I don't think it would be surprising, likely to any of the folks joining today, that a lot of heat injuries go unnoticed or are miscategorized. People coming home from work that maybe have some of the symptoms that they didn't want to bring up within a work setting. And there has started to be a lot of research and findings across the US and globally that many injuries that aren't necessarily categorized as heat illness are linked to heat. Were you in a hot warehouse and you fell off a ladder and broke an arm, but that was not reported necessarily as a heat injury. And so this is a well-categorized effect that we're seeing on the workforce and starting to get a lot more focus.
Absolutely. We're still continuing to get some feedback here, everything from environmental. I really like that as well. The temp sensors, that's fantastic. I like the supervisor training as well. These are all great input here. There was a question that already came in, and Dr. Cherry, I'll come to you first maybe on this one, but the question was that there's an organization that's listening now, and the majority of their employees are Hispanic, so they're Spanish speaking. And so the question was, how is it that you can kind of get around that barrier and be able to communicate to them what it is that they can do from a heat safety perspective?
And really, they're saying language is the barrier.
Mm-hmm. Language is the barrier.
Yeah. So, in my experience, I've always it seems that there's usually a few employees that are bilingual, and if you can kind of partner with them to kind of be your safety champions, that's kind of like an informal way. If this is something you really want to focus on and you don't have that kind of internal resource, then perhaps get translators to do some of that work, especially if it's just signage or even protocols to be translated into the other language, so that way it's better communicated. But I do appreciate that can be a challenge, but I do think there's ways of getting internal safety champions that can usually translate, etc. But you also do worry a little bit about quality, so maybe also making sure that you do have a valid, translator as part of the team.
Absolutely. And we were reminded, we actually just did some posters that were bilingual, specifically about hydration. So if you're needing some resources there, let us know. We'd be more than happy to share that with you, share a link so that you could utilize that in your own facility. In terms of what's being missed and why that's maybe happening, you can't fix what you don't know is already a problem. So therefore, what is it that's happening behind the scenes that maybe people don't see is going on whenever there's a heat concern? Dr. Cherry?
So I think Axiom's been focusing on hazards that are not readily apparent in the workplace, but they're hiding in plain sight. So, we've been talking about fatigue in general, and heat is a major contribution to fatigue, and in both senses. In our body as a biological system, we have physical fatigue and we have mental and cognitive fatigue, and heat absolutely impacts both of those. And so I think that's the biggest challenge. Is it's a kind of a ubiquitous exposure. Everyone's kind of dealing with it at the same time. So culturally, people are just trying to be resilient and push through it. But at the same time, that's why it's missed. It's kind of this very common exposure, and it's very subtle and gradual until it isn't. One of the points I like to make is, if you are, a gallon of water is about 8 pounds. So if you weigh yourself at the beginning of the day and then at the end of the day, if you've lost even 4 pounds after sweating all day, you've lost a half a gallon of water, which is a lot of it's coming from your circulation system. So your physical capacity is probably reduced 10 to 20% based on that alone. And so then that's why you have the risk of injury from just decreased capacity and the mental fatigue of, reflexes, judgment, impulse control, etc.
Agree. Lots of great comments still coming in. I'm seeing pickle pops. I'm seeing Gatorade, popsicles, everything there. Electrolyte tablets. All are great suggestions there. So keep those coming. I'm sure everyone else is looking at those too. Dara, I was going to ask you, going back to the misclassification there, what is the cost that would be associated with misclassifying these types of injuries that could be occurring?
Well, I think in our audience, we have a lot of safety professionals. And if you think about the primary goal of the partnership between safety and medical, we're trying to help prevent the next situation from happening. And if you misclassify, the risk there is that you're not necessarily focused on the root cause of what these incidents are, or what the reasons behind these incidents are. So if a slip and trip occurs, but you don't realize it's associated with heat or dehydration, then you might be missing ways to prevent the next one from occurring. So I think we've said this, but it was really interesting to Dr. Cherry and me, because we, about a year ago, probably, or maybe a year and a half ago, started thinking about why do our cases increase during hot days independent of heat-related diagnoses in our data. So if we think about that, we started to kind of really dig into our own data to try to understand what was going on. Why do we get more cases all over the diagnosis spectrum in those hot days? And so that kind of started leading us to think a little differently about heat illness.
Absolutely. Do you feel like that there's employers that, or leadership teams that perhaps maybe have a false sense of security in terms of just not understanding what really goes on in or how many heat events that they're actually having that are misclassified?
Yeah, I mean, there's multiple factors that are happening with these injuries, and I think the more, maybe I won't speak to Dr. Cherry, but like he said, these hidden components of it, I think what we're finding more and more is that, just like we always say, it's not mind and body, or mind or body, it's always going to be, the same. It's just one human body. And it's the same thing. All of these factors, there's so many confounding factors, so many components to injury that might not have at first glance be as obvious. And so Dr. Cherry and I just came off of a presentation with a site, and we were talking about fatigue and mental health, and then I mentioned something about all of the energy drinks in the fridge across the room from me, and we started talking a little bit about heat, and Dr. Cherry brought up the idea that these are all linked components and factors within injury. And so yes, if we have a slip and trip or a slip and fall, we want to know the physical reason somebody slipped and fell. Was it an obstacle? Was something in the environment causing them? But there's other factors that you need to make sure that we're understanding, so that it's a little bit more holistic of an approach than looking directly at A plus B equals C.
Agree. Matt, I'll come to you next. Whenever we talk about some of these things, heat doesn't always send people to the ground. Dr. Cherry mentioned that previously, that it doesn't always have a face. It doesn't look the same on every single person. So what is it that, where would people be able to identify some of that information within their data? How would they be able to look at that data before it becomes an incident to determine where they need to put their focus?
Yeah, and I think there's, most companies have some kind of standard heat management plan, right, where they're doing what they should be setting out to do, which is to provide access to water and shade and those kinds of things. To Dr. Cherry and Dara's previous point, it can be really difficult because there are so many compounding factors, right? The same individual that may come into work tomorrow with a different metabolic state, or they may be acclimated, or maybe they get off a 2-week break where they lost 80% of their acclimation. So there's physical factors. There's also safety culture factors. Are they trying to push through work? right? And try to get the job done. It's easier to crimp something and get it finished than it is to climb back up a ladder and then have to resuit and go back down. And so I think there's a lot of culture factors. And then there's societal things like energy drinks that people may be taking, or, the Monday morning problem is something that we hear, a lot about. And so what we try to do is look at some of the physiological risk factors from more direct monitoring as an enhanced layer on top of your standard heat management plans. In terms of what we look at from like a incident pathway, a lot of times what we see is that there's, your physiological strain. People are responding to heat, they're sweating, they're losing blood volume because of that sweating. And so their heart is working harder. And because of that, we know that even mild levels of dehydration and heat exposure can lead to significant cognitive decline in terms of attention, reaction time, and judgment. And then that can lead to failures in poor decision-making in the field, cut fingers, slips, falls, and those kinds of things. And so I think the industry broadly is moving towards more of a leading indicator approach, trying to catch things earlier rather than just trying to, wait for something to happen. Because when someone's core temperature is rising, you don't have a lot of time to make an intervention. And so how can you continually shift to programs where you're working more on the preventative side of that?
I agree completely. Dr. Sherry, the conversations came up about the energy drinks and what it is that you should be hydrating with. Do you want to kind of give us some guidance in terms of what best practice is, or what they may want to look at within their own organizations as far as what employees are drinking or what they're offering to them to keep them hydrated?
Yes. So, I agree. I think even the military was banning energy drinks in deployed theaters because of the concern for dehydration as one component. And so a lot of the energy drinks will have some kind of stimulant or a host of stimulants like caffeine and other supplements like ginseng that, are technically stimulants. Caffeine does create some dehydration because it raises your blood pressure, and then so there's more blood volume going through the kidney. Some studies have now reversed that and said, well, the amount of water in a coffee kind of balance that. But I think when you're doing strenuous work in heat or heat stressed areas, you probably are still a net negative for hydration. And then if we think about sugar with the stimulants, high blood sugar is diabetics are actually well known for urinating frequently, well beyond their need to withdraw water otherwise. So they are very prone to dehydration. So, an energy drink with a lot of sugar and these stimulants can really push or really accelerate dehydration. And then, what's been so impactful for me professionally over the last, couple of years, what Dara alluded to, it was really an epiphany to me that we had these huge increases in injuries in the summertime that aren't necessarily attributed to heat stress injuries, but they're all types of injuries still. And I think it's that cognitive decline also. So these energy drinks are masking that cognitive decline with that short-term stimulation, but it's kind of a false boost, so to speak, right? Like our minds are still not where they should be if we weren't fatigued from heat stress or just being, poor sleep, poor nutrition, etc.
Right. Dennis, I love what you go ahead. Go ahead.
Jump in? I'm curious, we hear a lot on the caffeine side, right? And people have to work 16-hour shifts and they do it for 14 days in a row. We also hear quite a bit on the sodium and electrolyte supplementation side, and not everyone needs it, but the people who do need it really need it. Dr. Cherry, I'm curious to hear, what are you all hearing from the field, just more on the, electrolyte and that kind of side in addition to caffeine?
I think electrolytes are very critical in a rehydration strategy. If someone is really dehydrated, it's really difficult to just hydrate them with pure water. The way our bodies actually sweat, the mechanism is actually our body secretes electrolytes through our pores, which then pulls the water. And so essentially our electrolytes are depleted along with the water. So dehydration is it's obviously our bodies are low on water, but it's also low on electrolytes, and we can't really absorb additional water unless we absorb those electrolytes, because our sodium and potassium concentrations are highly regulated in our blood. So if those are just off by a little bit, it really, that's why we have significant muscle cramps. But you can also have, even heart failure with potassium disturbances and things like that. So it is really important to use some type of electrolytes with your rehydration strategy.
Thank you. You guys are putting in such great comments and questions in this chat. There were several that caught my eye that I wanted to follow up on just before we went to the next section. One was they were asking about blood pressure medications, diuretics that employees may be on. What's your thoughts, Dr. Cherry, in terms of how do you address that if you don't know that an employee is on that, or if they are you going to treat them any differently, or are you going to make any special provisions? Should you have different types of plans for them? What would you recommend in that scenario?
Yeah, I think you could think from a first principles perspective. If you do have heat stress as a significant hazard in your workplace, and that workplace can be indoors, by the way. Sometimes indoor factories can be hotter than working outside because of poor ventilation, and a lot of factories are not air conditioned. So, but I think a medication review would be huge as a safety component of your heat stress program, because blood pressure medicine is literally, it's doing actually what dehydration does. Like it's lowering your blood volume artificially to lower the pressure. And, so it's kind of like classic physics, like volume and pressure are related, they're correlated. And so, and some blood pressure medicines, actually, their mechanism of action is to lose sodium through the kidney. And then by there, you have this diuresis, you have this urination coming with it. But all blood pressure medicines, even if they function in a different mechanism, they're lowering your blood pressure. So if you dehydrate with blood pressure medicines on board, you're going to have even a more pronounced low blood pressure, fatigue, because these blood pressure medicines either slow your heart rate down or dilate your blood vessels. And so when you're dehydrated, your heart rate actually goes up and your blood vessels constrict. So again, your blood pressure is not, we used to have to manage that in internal medicine, where the summertime comes, you have to actually reduce people's blood pressure medications. That obviously has to be done by your doctor, but I think a medication review is a strong component for a heat stress injury program.
Agree. Dara, do you want to talk a second about what medication reviews are, why you would utilize those within the workplace?
Yeah, like Dr. Cherry said, if you have employees, especially in safety sensitive roles, we know that, actually this came up in our presentation this morning, that employers still have very robust drug and alcohol policies where they test
Sarah, can you hear us okay?
I can hear you, Holly.
Okay. All right. I think maybe Dara's sound went out for a second, so that's fine. The other one I was going to ask, Matt, was to you, and that was specific. There was one that had mentioned that they had worked at a construction site and were familiar with people putting a monitor there on the forehead that was monitoring the body temperatures. Are you familiar with that? And what's your thoughts in terms of utilizing that type of technology within the field?
Yeah, and I don't know what that specific product is, but obviously I think 20% of the blood flow goes to the brain, right? And so there's a variety of different technologies out there that use that as a nice measurement for core temperature. And interesting fact on sweat generation, that forehead typically is a spot where your sweat generates earlier, and it's one of the earliest signs you can tell if you think about leading indicators. So I think any kind of technology where you're starting to better understand your workforce and enhanced engineering controls on top of the bare bones things that you have to be doing with the heat management can be very well informed. I would think about adoption and how you're encouraging the responses to those kinds of things. But I think technology, is going to have a broad impact on the market in terms of enhanced controls and safety awareness for individuals.
I agree completely. It's amazing how far that we've come, and there's so many different resources now and tools now that we didn't previously have. So it's like prevention now has a place at the table where previously we were just looking to, our role was in treating the injury or treating the illness whenever it came to that point. So it's so encouraging that we now have a different path that we can look towards to protect these employees.
Yeah,
Dr. Cherry, yeah, go ahead.
I would say it enables, things that we weren't able to do outside of a clinical setting before.
Yeah.
We look at some of our, we have a wearable platform, and we look at some of the data coming out of that, and we find almost 20 to 30% of shifts with heat exposure in our target industries have some kind of physiological risk factor associated with them. Now, whether every single shift, is going to show up in an incident, that's hard to guess. But if you start to look at things like dehydration, total sweat loss as a leading marker, time at elevated skin temperature, cumulative days exposed to heat and exertion, you can start to get some, more pinpointed strategies on mitigating the risk factors out in the field. And one of the challenges I hear a lot of times from our customers is it's almost like playing whack-a-mole, like who's at risk at what time and how do you mitigate that? Because most people have made big strides, but it's like the final few incidents and injuries that can be difficult to pinpoint without looking at a broader picture of physiology and safety culture and risk in the field.
Absolutely. Dr. Cherry, there was something that caught my attention, and they were talking about the taco method. Are you familiar with the taco method for rehydration?
I'm not, so I would love to hear about it.
Yeah, I would too. Okay, well, that's our homework then. Thank you for the tip, and we will definitely go back.
Is it an acronym or is it truly a taco? Because
no, I think it's an acronym. Yeah,
okay.
I would assume that it's an acronym, not versus a crunchy taco there. But yeah, definitely, you got my attention by saying taco there. That's interesting. Well, I'll have to look that up directly. All right. Well, Dr. Cherry, then talk to us then about employers. Talk to us about that cognitive impact that happens so early on. So you have an employee that they may not even look like that they're in trouble at that point. You're not recognizing that. But what is going on with the brain? Why is it that the brain is impacted first in these types of scenarios?
Mm-hmm. And Matt alluded to it. He said 20% of the blood flow goes to the brain. That's what you said, right, Matt? I don't want to misquote you, but that's what I was tracking as well. And, the brain is, no matter how big our egos are, our brain is probably only 2% of our body weight, but it's getting 20% of our cardiac output, our blood flow. And so that's why our cognition, our mental and cognitive fatigue is so sensitive to hydration levels, because say you lose just a couple of pounds of water from sweating all day, that's going to dramatically lower your cardiac output to your whole body. But because your brain is literally getting the lion's share of cardiac output, especially compared to its relative size to your whole body, it's going to be the most sensitive in isolation. Now tack on other reasons for fatigue, like poor sleep, poor nutrition, working long shifts. You're going to see all of these risk factors stack synergistically in a negative way, and that's why you're having this cognitive impact. And it's subtle until it isn't, right? And so we have a lack of an awareness of our fatigue, even physical probably, but definitely mental and cognitive. And so there's really a lot of errors occurring, but probably along the near miss continuum, not at a real incident until it's too late.
Yeah. Dara, would you say that this is maybe a blind spot and people are just relying on observation alone within their organizations to monitor heat?
That's a great question. I'm assuming I know what you're talking about. Apparently my house overheated with the Texas early summer, late spring weather happening here. Yeah, I think so. I think it's just, making sure we're monitoring all of these components, if I think that's what you were asking me.
All right. Matt, I wanted to ask if you could kind of walk us through what the overview is from an OSHA perspective whenever we speak about heat and where our focus needs to be.
Yeah, and I'll lead with, if you're one of the 22 new industries under this emphasis program, you have until July before you may start looking at citations and questions from OSHA. But the updated heat national emphasis program from OSHA is still focusing on preventing heat illness, but it's tightening to a new list of industries and expanding that. So it has 22 new industries and extending the program for another 5 years, and does some things like raising the expectations on checklists for heat programs, more rigorous citation guidance. And we have right now a 90-day outreach window before program inspections start. So definitely something that you're going to want to be mindful of. And even if you're not, a new industry, if you've had previous citations, you could still be under the focus area there. So definitely something you need to be cognizant of.
Do you feel like that we'll see an uptick in concerns or a push from OSHA this year now that we have new guidance?
Yeah, it's always hard to guess on the regulatory side, but I will say that our customers, are concerned, and the folks that we work with out in the field. This is the number one thing that we get asked about now, is starting to look at the checklist that's going to be coming in terms of citation guidance from OSHA, and making sure that people are well prepared, for that. And especially if you're one of the folks in the new industry targets here, to make sure that you're up to date on it. But it can be hard to predict, where OSHA is going to go in the next 5 years.
Exactly. Were there any of the additions that were added to the list? Any of them surprised you this year?
I don't think it's necessarily surprising. I think on a broader effort or exposure profile, most industries have some kind of exposure to heat, right? And so I think it's great to see additional emphasis on, safety outcomes in the field, but adding, almost half again as many target industries in here. Some of the new ones on electric power generation, transmission, distribution, steel product manufacturing, animal slaughter. These are all, new industries that are going to be targeted and have to be aware of, what they need to be doing and how to handle it.
All right. Okay. In terms of what OSHA would evaluate, Darryl, I'll come to you first. The old saying was, if no one owns the heat program, then the heat program owes no one. So what would you say whenever you get into the issue of policy versus practice, or policy versus program, what would you say the real difference there is between just having a process and really having a program that's working for employees?
Yeah, and I think a lot of our people that are participating, I've seen a lot of comments about how individually they're helping people, but I think and then some have been mentioning more programmatic or systemic approaches. And I think within the locations, if somebody, you're paying attention to individuals, yes, you can pay attention to individual patterns within a person and making sure that they are taken care of. But from a programmatic standpoint, a system standpoint, making sure this is all built in to various components of safety, health, and environment, so that it's not a single thing that we are doing, but it is taking all of these different components together, building programs to prevent the heat illness or the incident from occurring before it occurs. So yes, we know that water availability is important, but it's not just water availability, it's all of these other things taken together.
Absolutely. Dr. Cherry, what are your thoughts on, there's a lot of discussion about acclimation and different ways of doing that, or they're looking at the employees new employees, or maybe you have someone that's coming back from a post incident and they're coming back into the workforce and they've been after being out. What are the risks that are associated there, and how is it that employers should really kind of mitigate that in terms of making sure that your employees are ready to be exposed to the sun?
Yeah, so definitely, allowing an employee to acclimate to heat is crucial. So, we have super strong data on new employees are at very high risk for injuries across the board. And so, but I think what people might forget is it could be a tenured employee that's coming back from even just like a vacation or, an extended absence. They also need to acclimatize to heat, because our bodies can adapt, but we also, decondition from that conditioning. And so you do want to have this graded policy where people bring people in slowly. And what's also even sneakier about heat stress is a lot of times people manifest their heat stress symptoms at the end of the week, when maybe even, say they start on a Monday and it's hot Monday, Tuesday, and then, Thursday and Friday kind of are cooler, but not cool. But, heat is cumulative. So even if things cool off, if it's still hot, it's still adding to the heat stress. And sometimes people are symptomatic and don't even understand it's coming from heat stress. And then again, medications are absolutely one of the biggest culprits. And it doesn't have to be blood pressure medications. One of the biggest culprits is just allergy medicines. Even over the counter can totally dysregulate our sweating ability to cool off. And so, there's many things actually going on that that's why you need a program that addresses, the individual factors as well as the environmental factors at the workplace.
Agree. Haley, really good point there. Haley was mentioning that they provide electrolytes to the employees, but they struggle to get people to use them. What kind of recommendations, and I'll open this up to everyone in the group, what kind of recommendations might you have for Haley in terms of being able to educate their employees so that they are using the resources that they're giving them?
I'll go first. So I think education is minimum, is necessary but not sufficient. Having some safety champions to actually show the difference it makes will absolutely be critical. I think it's just there's infinitely complex things out there for all of us to be aware of, and we just can't. So we almost need to be kind of spoon-fed certain things. So even having your policy say, okay, 1 glass of water and then 1 glass of electrolyte solution, have something that kind of makes it very regimented, but it will absolutely make a difference in the hydration ability for your workforce.
Mm-hmm. Dara, Matt, anything that you want to add to that?
I thought there was a really good question here about Epicore and physiological differences relating to what Dr. Cherry was talking about. I think they just wanted to know, does Epicore's device take into account differences with different fluid loss for those individuals? So if somebody is dealing with something like blood pressure medication, is there a way to kind of adjust for that? And the person also said some groups that use Epicore have a hydration hero set up.
Yeah, and I'll add to that. So, what we do well and try to bring to the organization is direct measurement of physiological markers like sweat loss, skin temperature, activity, as what is happening in the body and what comes out, in terms of, safety. So I think some things that we're able to pick up on, we don't necessarily log when someone's taking blood pressure medication, right? That's a medical intervention. But what we will do is look at people's physiological changes over time. Did they come in on a Monday and their sweat profile changed compared to, when they were in the middle of the week and those things. So we look a lot at trend information over time for those direct measurements. And then maybe tying it back to the earlier question too, on electrolyte availability, one of the things that is really powerful physiologically is that there's a vast difference across people in terms of how much they sweat, how salty their sweat is. And so I think education on what is actually happening in the body and that different people have different needs, in addition to access to electrolytes and water, is really important when driving behavioral change. And to Dr. Cherry's point too on, do you have champions and advocates? When you can encourage people to better understand their own health and talk about it with their other folks and improve your safety awareness and culture, I think that's when you can help to improve adoption outside of the things you're probably doing, like sharing messaging one-pagers in education in those settings.
Okay. Dr. Sherry, we have a response back. So TACO stands for the TACO method. They said is TARP assisted cooling with oscillation. Are you familiar with that?
TARP, say that again?
It stands for TARP assisted cooling with oscillation. They said it's a rapid life-saving emergency technique to treat the heat stroke by using a tarp and ice water to lower the person's core body temperature, and which involves placing the victim on the tarp, adding the ice and water, and then moving them to circulate cold water over the body there.
I'm not familiar with that specific approach. I do know in emergency response cooling, there are different approaches about, is rapid cooling the way or slow cooling? And it's probably beyond this webinar. It's more of kind of in the emergency room setting or, in pre-hospital, like ambulance type response. But no, that is very interesting. I was not aware of.
Yeah, something definitely new. While we're on the topic, talk us through briefly what your response plan should look like whenever you would assess if you have an employee that you think is struggling with heat illness. What should your response be at that point?
So getting an evaluation as soon as possible. So having employees report symptoms as soon as possible is absolutely crucial for, in our opinion, any injury or any illness, because you have the most opportunity to make a difference regardless of what it is. Heat stress can mask other things like, the most common concern is, heart disease and heart attacks and strokes. So you do want to get that type of medical consultation as soon as possible. And, once the emergency concern is ruled out, then you can approach it with more conservative measures like, rehydration, rest, and monitoring for improvement. But you do want to have a written plan that addresses, again, ensuring an emergency medical condition is not happening in real time.
Mm-hmm. Dr. Sherry, there was also a question that came directly from Justin that said, New Mexico has been trying to develop a state-specific heat stress standard for the last few months, even though it's been delayed several times. But curious if this group is dealing with some of the new potential requirements. We are particularly interested in some proposed heat stress assessments and medication reviews. And so the question was, have you seen this being done in other environments, and how could this be performed in workplaces?
And are they asking about medication reviews or something different? I missed the ask.
That's my interpretation, is that the medication reviews, and then also, let's see, there was one other, heat stress assessments.
Yes, so, when I was in the Army, we had, heat stress programs that would do kind of the medication review, but also do a physical and assessment regarding, what other comorbidities or chronic medical conditions they're dealing with, and so you do have a holistic approach. But I would say if a company is doing nothing, then having a written program at minimum with emergency response and what to do next. But just doing a medication review would be huge, because if you look at the population health data, most of the adults in America are on at least one medication and maybe multiple, and many of those can affect heat stress resilience. I was just thinking of my time in New Mexico. So New Mexico and other places that have high elevation and low humidity are like, brutal for heat stress. We used to manage I used to support the Baton Death March in New Mexico, and we had elite athletes coming in with severe heat stroke from, you know, halfway through the marathon because of the elevation and low humidity. So, you know, what's very interesting to me is, you know, having direct measurement of hydration does seem like a game changer because it's a leading indicator. It's not a lagging indicator. So I know there was a question to Matt about, does it take into consideration medications? But really, at least from my perspective, what I really care about is the current hydration status. And if they're on medications that predispose to faster dehydration, then it's even more important to have that direct indicator of hydration status, you know, so it would be even more important if you were only dealing with a lagging indicator like symptoms, right? That you know someone's on medications, et cetera.
Yeah. Matt, you had brought up the issue of OSHA a while ago, and whenever we look at it, it's usually not the policy that the gap is located there. Whenever they come in and they're doing some of these, looking at your policies, your procedures, things like that, it's more so the proof. So where do you feel like the employers are getting stuck? They may have a policy, but yet OSHA finds something differently whenever they come in.
Yeah, I mean, I think some challenges around the first one, right? Inconsistent break performance. Are they actually scheduled? Are they enforced? And are you documenting that consistently across crews? OSHA may have an emphasis on these, but how are you going to actually, you know, go out and improve that that's happening? You know, the lack of acclimatization tracking. Again, when are you looking at shift schedules? Are you documenting that? I even saw, you know, in the national emphasis programs, you know, snapshotting things, you know, on your phone to say, okay, we've documented this. We've looked at different temperature profiles. So I think it's an additional focus area on not are you just, you know, saying what you want to do, but are you documenting that? And if you had someone come to your site, could you actually prove that that was the case? And so I think, you know, there's obviously the documentation side, but, you know, in the future, there's going to be more on, you know, wearables, I believe, on being able to document what's actually happening as a, you know, a claim trail almost of, hey, we've done these things and we have the data to prove it and it's time stamped. So those are just some things to watch out for that, you know, inconsistent break enforcement. Can you document your acclimatization tracking, and how are you actually, you know, storing all that information in for some kind of audit or compliance check?
Okay. Dara, so if we wanted to get a little bit better with our incident reviews and what's happening with employees, there's been debate about whether you should be adding some additional questions. So the top 5 that were suggested were fluid intake in the last 4 hours, your break timing versus what your regular schedule is, looking at what the heat index is, looking at the hours into the shift, prior symptoms, anything along those lines. How do you feel like do you feel like that's appropriate to incorporate into your safety program, especially when you're looking from a past, you know, if you already had an employee that had a heat related incident, would these be the types of questions that you would want to ask when you're looking at someone else that was having that? Do you think that this would give you some more insight into what's going on?
I mean, I think I might let Dr. Cherry answer that specifically in terms of how you want to dig into the individual. But I think I've seen a lot of the conversation back and forth in our Q&A and our chat about some things that have been instituted in some of that sounds like our attendees' sites. And what's really interesting, it's not just addressing the individual, but if you can address it from a systems perspective. I saw somebody say that they require 15-minute breaks every hour. And I think it's things like that. That way, it's not whether this individual is hydrated or not. It's just making sure that you're preemptively managing those really hot days and getting the support for the whole team, not just an individual who might be symptomatic or have issues. But when we think about these questions in general, I think they're great questions about creating, you know, thinking about systems and making sure that your whole approach takes these different components into account. But it's also just making sure that, I think, not to hit this over the head, but Dr. Cherry said, if you suspect anybody is having any concerns, calling in for support be it Axiom or whoever you use, to make sure you have medical decision making there paired with your safety decision making.
Mm-hmm.
Scott, I'll let you maybe weigh in on the individual pieces here.
Yeah, so this kind of reminded me that when I put my OSHA hat on when I was there as a resident, like there's not an existing heat stress standard if I'm still up to date. So the National Emphasis Program is probably authorized through the General Duty Clause. So that's OSHA's mechanism to address any workplace hazard that's not addressed by its specific OSHA standards. And so I think this is really an opportunity that gives the affected industries, it gives them some guidance to somewhat be compliant, but it looks like OSHA is still focusing on this as best they can, even if it's not through the political process of getting, a new heat stress standard promulgated. But, what's listed here looks very strong. And the things I would say, that especially if this is an incident review with a bad outcome, is what was the time to report from symptoms? Because when you think of the symptoms of heat stress, they can easily be the same symptoms as a heart attack or stroke or a diabetic, episode of high or low blood sugar, et cetera. So, what you might think is a kind of a very simple heat stress incident could be, a host of other things. So it sounds simple, but it can be very complex to navigate.
Great. Matt, I'll come back to you as we kind of wrap up here, but whenever you look at the 3C framework, and so you see cognition, which, is heat affecting your judgment, you have compliance, can you prove it? And then capacity, do you know the worker's strain and not just the temperature? What does that tell you? The body tells you what the risk is. So how do these layers kind of work together whenever you're looking at that from a holistic perspective?
Yeah, traditional safety programs tend to focus on two things: compliance and capacity. Are procedures being followed? Is the workforce trained and physically ready to do the job? Cognition, I think, is a third factor that often gets missed. It's a leading indicator. Are people making good decisions? And are there things that are causing them to make poor decisions? Physiological risk factors associated with heat exposure, dehydration, fatigue. Cognition is usually the first thing to drift under heat strain or dehydration. Capacity is next. Is your body compensating for a period of time? But then that window starts to close. And then compliance, are you documenting a break that was missed, exposure that was built up, or incident that has already happened? So I think, to me, it's a left to right. How do you start to tackle this across all of this in addition to what you're already doing on a heat management plan? And I think that the wearables can help to add some value on leading indicators and addressing some of the physiological risk factors associated with poor decision making under different types of exposure and stress before it becomes an injury or a near miss or productivity losses.
Absolutely. Dara, how does this make your program more defensible if you incorporate these 3 C's within your program that you have?
Yeah, I thought Matt said it really well. I think it just makes it a more holistic approach and thinking about it from various components instead of the historically managed programs. Like I keep saying, Dr. and we're talking about fatigue this morning, and all of these pieces are. I think we even had somebody ask about fatigue and the relationship between fatigue symptoms and heat-related illness symptoms. That is so critically why you have partners in this to help determine some of the components of whether it's fatigue or illness or injury or these different pieces, so that we can manage it to the best of all of our capabilities and helping kind of inform back into the system so that we know what we can do to prevent it for the next time.
Agree. Dr. Sherry, what's one recommendation that you would give everyone before we close out here in terms of what would be your one tip in terms of heat programs or how it is that you can protect your employees this season?
One tip, just one, huh? Um, I think what's hitting me lately in our work is that these common and usually forgotten or just under recognized hazards in the workplace are driving a lot more of your outcomes than you think. So start thinking out of the box about some of these things.
Awesome. Well, thank you guys so much for joining us today. This has been a fantastic conversation. I love seeing everything that you put here in the chat. I love how you guys are interacting with each other, learning from each other, sharing some of those best practices. That's exactly what we created these events for. So thank you to you guys, and we'll definitely be looking at the comments that were there, and you may hear from me after this. So have a great day.